Okay, well, it is just 1 o'clock Eastern, and I do see a few people who are joining us still, but in the interest of time, I want to go ahead and get started. Good afternoon, and welcome to today's webinar. It's hosted by the Georgia chapter of HFMA. I'm Laurie Heavey, and I'm a Georgia HFMA Education Committee volunteer. Welcome to week 2 of our Wednesday webinar series, which are running now through the end of May. And as a chapter, this is one of the ways we're staying connected with our members and providing ongoing education. We have always provided webinars, but since we are all sheltering in place and practicing social distancing, we wanted to make sure that we were providing that continuing value add and getting education out there to our membership. We're excited to present today's webinar. It's entitled, "What Comes After the Pandemic? Do Your Patient Engagement Strategies Lead to a Long-Term Relationship?" But before we get started, I want to just quickly review a couple of housekeeping items. Excuse me. All of the phone lines are going to be on mute to avoid interruption during the broadcast. Later this week, by Friday, you'll be able to download the presentation from the Georgia HFMA website under the tab entitled "In Case You Missed It." We'll also post the recording to our Georgia HFMA YouTube channel. And everyone on today's call is eligible to receive continuing education credits. For participating, I will be sending an email, again, probably by Friday, with your form, and so be on the lookout for that email coming Friday. And at the conclusion of today's webinar, we have a quick Q&A, and please submit your questions in the box. Okay, so sorry about that. We do have a survey at the end, but what I wanted to talk about now is we will be doing Q&A. Pete will be doing Q&A after his opening remarks, and please use the question box at any time to ask your questions. For today's presentation, it's my pleasure to welcome Pete Thompson. He's Senior Vice President and Senior Revenue Cycle Strategist for ClearBalance Healthcare. Pete began his career with Cardinal Health before moving to ClearBalance in 2004. And ClearBalance works with health systems nationwide to make care affordable for consumers through zero-interest patient financing. Pete has served in multiple customer performance roles with ClearBalance related to patient engagement, patient self-service, revenue cycle IT integration, and patient financing workflow. Pete was the architect of the ClearBalance ROI value model, and this is the only patient financing benchmark tool to receive HFMA peer review recognition now for 6 consecutive years. In his role as Senior Revenue Cycle Strategist, Pete has counseled health systems, their revenue cycle leaders about their patient engagement and financing workflow, and that's all to drive optimal results. So Pete, I will turn it over to you. We are ready to begin.
Great, thank you, Laurie, and thank you everyone for joining today. As Laurie mentioned, today's conversation is going to focus on patient engagement tactics and recommendations for innovation in how you can better use those patient engagement tactics to drive long-term relationships with your patients. And we know that right now your regular patients are staying home. You've deferred or delayed elective procedures so your clinical teams can focus on COVID-19 patients and emergent cases. And even those emergent cases we know are declining. Just a small piece of information I was able to pull from the University of California Health System. They're showing that automobile traffic volume is down 60% right now. And that's accounting for a 50% decline in roadway collisions. That's translated to 6,000 fewer injury accidents per month in the state of California alone. So we know that health systems are under pressure, both from COVID-related cases as well as declining volumes. And while it seems difficult to fathom, we know that we'll get past the COVID-19 crisis and start a new normal for patient engagement. Throughout the best and worst of times, consumer loyalty is influenced by how early, how often, and which methods we use to communicate with patients about their estimated cost of care and their payment options. We can expect that social distancing, telehealth, and online information will play a role in your future engagement strategies, But even then, there are some fundamental levers that you can pull to create an experience that leads to a long-term relationship for patients. So what constitutes innovation in patient engagement tactics? We know that it's not always something new or something techy that constitutes that innovation. Innovation can be thinking outside the box using what you have today. And the goal for our conversation is to shine a light on different ways to think about patient pay and engagement tactics to drive innovation. I want you to think about your goals related to your patients in the community. Working from the bottom up, first of all, you logically want to attract consumers to your health system. You build their trust by delivering quality care and an excellent experience. And if you do all of that well, that translates to loyalty. Now, in addition to the clinical experience, we want to understand if you're pulling the right levers to create an experience that leads to a long-term relationship. So in today's discussion, I hope to explore with you some new and best practices to meet the patient at every touch point to create a first service to next service financial strategy. So I'd like to start by thinking about consumer expectations for healthcare, and equally important, their perceptions of healthcare as both influence consumer behavior. At ClearBalance, we conduct an annual study of healthcare consumers focusing specifically on the revenue cycle experience. The good news, relatively speaking, is that in the 5 years we've run the study, we've found consumers have transitioned from being taken by surprise that they'll have high out-of-pocket costs to beginning to regard healthcare as a retail transaction. Now, of course, that means we as health systems need to change our focus to think like retailers. Some additional key takeaways we had from that study. First, we found that consumers now expect to have an out-of-pocket cost. Secondly, we found that consumers expect that we as health systems will make repaying their cost of care affordable and easy, whether that's through upfront discounts or long-term payment options. To that end, we found that 79% of patients said that they asked about payment options, and 94% said that they expect us as healthcare providers to be able to tell them about their payment options at the time of care. Further, we found that consumers will judge their financial experience on more than just the billing statement, but the billing statement has to be easy to understand. And finally, we found that long-term payment plans are more common, and we've seen consumers share and compare their experiences with friends and family, specifically about the payment options they receive as part of their healthcare journey. So back to the idea that health systems should think and act like retailers, thinking in terms of exclusivity and convenience. What we see is that patients are managing their healthcare costs in a retail fashion. They're paying down their payment plan debt, but they know they can easily add on cost as they receive new care, hopefully at your facility. And then where exclusivity comes in, if you're providing patients a long-term payment option, you should really consider a program that's exclusive to your organization, not a program or a medical credit card that can just as easily be used at your competitor's location. So moving on to consumer behavior, we want to highlight an NCR study that showed 80% of patients reported that convenience factors alone would be enough to make them switch providers. These factors include access to care and wait times as obvious points, but there are other factors to consider, and we'll dig into those during this conversation. This is important because there's a tangible cost to that convenience. According to that same NCR study, the cost of losing one patient is $1.4 million in revenue over that patient's lifetime to your health system. And on the flip side, there's also a tangible return by investing in the patient's experience for convenience. According to the advisory board, a patient who returns to your health system within 18 months can generate up to 6 times the amount of revenue that they would generate in their initial experience. And we believe there's even more value when you offer patients a long-term payment plan. By having that payment plan in place, you now have a captured consumer, which enables you to protect and even gain in your market share. Earlier, I mentioned our healthcare consumerism study. So I wanted to share some select statistics from that study that relate to driving captured consumers with long-term payment plans. We found that 90% of respondents said that they were very likely to return to a facility because of the payment options that they're being provided. And 88% said that they would refer family or friends because of those same payment options. Moving beyond just the word of mouth from the patient saying that they would return, we found that over half of patients actually did return and used their long-term payment option to address the cost of more than one procedure. I talked about comparison shopping even for payment plans. So just a small plug here, 70% of our respondents said that the ClearBalance option was a better option for long-term payments than they were being provided at other facilities. And one other important note, if you take away that convenience, more than a third of patients said that they likely won't seek care because they think they can't afford it. Now, we know that people don't typically magically get well. So more often than not, those individuals show up in your ER even sicker and at a higher cost to the organization. So following along with what we've been discussing, I know that many of you are likely moving or have moved the financial conversation to the front of your patient engagement process. So keeping in mind the idea of a captured consumer, we recommend you think in terms of a pre-service to next service patient financial journey. The approach eases patients' concerns about their out-of-pocket costs. It gives them reassurance throughout their care episode, and it positions your health system as the logical, affordable choice the next time they need care. So looking at that pre-service area, we want to make sure that we're providing the patient with enough financial information so they don't delay or defer their care. At your on-site registration, we want to make sure that we're providing enough financial information to ease any anxiety the patient has about their financial obligations so that they can focus on their care and their clinical experience. A little bit later, we'll talk about some innovation at discharge, specifically looking to include a financial plan in addition to the patient's clinical or care treatment plan, and then following through the billing and collection process to get that patient to that next care experience, starting the whole process over again. So as we talk about innovation, we want to reorient our thinking a little differently to shine some lights on assets that may be available to you now that you can use to be innovative in changing the patient's experience. And those levers that we'd like to focus on today are to, number one, better engage our marketing groups. Secondly, we want to focus on thinking like the patient. Third, we want to make sure you're leveraging your CEO or your C-suite in those conversations. Next, we'll talk about maybe changing the role that you have for your existing care and cost navigators to better align them with revenue cycle objectives. And lastly, we want to talk about closing the loop with patients at discharge from a financial perspective so that we can better set expectations with patients as they're leaving their care experience. So our first idea for innovation is around engaging marketing. And we want to engage marketing in a way so that they're more than just focus groups or running focus groups in our organization. More and more healthcare marketing teams are engaging in CRM tactics to know your patients, particularly from a population health view, similar to the way Amazon knows your shopping habits. Now, we see a lot of opportunity for revenue cycle to work with marketing to really understand and leverage the benefits and consumer-facing changes that we're making in the revenue cycle group. It's incumbent upon us as revenue cycle leaders to educate and convince marketing that revenue cycle is a very important brand ambassador for your organization. Thinking about that in terms of the online presence of your health system, we know that about 77% of consumers search for healthcare services online, and 88% of consumers typically trust their online reviews. So to that end, we want to focus on a story from Sharp Healthcare. In Sharp's story, they focused on the language that they were using with patients, how they talked to patients. And really what they found was that one word can change the game in terms of patient communication. Sharp started its strategy by embedding someone from marketing in the revenue cycle organization. So that individual is actually a revenue cycle direct report with a simple dotted line over to the marketing group. And that marketing revenue cycle individual spent time with customer service reps and listened to them talk to patients. She then went on to talk to the patient after the conversation to better understand the patient's perception of that conversation with customer service. And what she uncovered was that patients reacted sharply to the closing statement that was being used. That specific closing statement being, "Thank you for choosing Sharp Healthcare." A number of patients made the point that they didn't necessarily choose to go to Sharp. So the team made a change to that closing statement to simply say, "Thank you for allowing Sharp Healthcare to provide your care." And that small change in wording truly made a difference for patients when marketing was engaging with those patients after the conversation. So our next area for innovation is to really think like a patient, to put yourself on the receiving end of a pre-service phone call, the text and email communication that you're sending to patients. We encourage you to search your website for financial information. And that's beyond just the pay my bill link that you may have on your website. Really looking at the financial information that's being presented to patients. We find that more often than not, a number of those financial information points will be out of date based on the current processes and procedures. And we also encourage you to experience a full financial journey from the patient's perspective and really focus in on what's lacking. To that end, we'd like to highlight a story from UConn Health. UConn Health's Chief Revenue Cycle Officer was focused on knowing and experiencing a typical patient journey. So to that end, she reached out to some patients with scheduled services prior to their care and asked those patients if she could follow them through their care experience and their financial experience. And by tagging along with patients and talking with them both a few days and a few months after their care, she was able to uncover a number of opportunities, including getting more mileage from their marketing, as we just discussed, but also around something simple like promotions on their video monitors throughout the facilities. Her specific story, they were running advertisements for Starbucks on their video monitors, and feedback that she got from the patients was the patients know where the Starbucks is just based on smell. They don't need to have it advertised. So they were able to refocus the advertisements in their video monitors to highlight their clinical areas of excellence and also highlight their financial information and their payment options for patients. And what they found was by doing that, when the patient engaged with the on-site registration staff, they were more prepared to have a financial conversation than they otherwise may have been. Another example around putting yourself in the patient's shoes that we'd like to highlight is from Mosaic Life Care. Mosaic Life Care has really redefined itself as an organization, moving purposefully from the notion of a healthcare provider to that of a lifestyle company. And to that end, they've really focused their entire team on thinking and acting like a consumer. They understand that consumers have a voice and choice in their healthcare, so they don't take anything for granted. One of the basic principles in their culture is to speak in English with patients and not healthcare jargon. And what they've found is that by speaking with the patient in plain English, they're better able to get the patient to participate. The patient becomes more vocal in their care and care decisions, in their financial plans, and in their financial decisions, and they're able to gather information that they otherwise wouldn't have from the patient, which leads to a more engaged patient and a better financial outcome. Our third area for innovative focus is leveraging our CEO, or leveraging your C-suite. We know that the shadow of a leader is paramount to an organization's success. And innovation in C-suite leadership should really be focused on ensuring your organizational leaders support your teams by practicing what they preach. As revenue cycle leaders, we have to support our staff by backing up policy as opposed to bending to complaints that are driven by the changes that we've initiated. Additionally, in smaller communities, it's paramount that C-suite leadership engage with other community leaders about changes that occur at our health systems to ensure transparency and to foster a sense of ownership with the community about the long-term financial health of your health system. So by way of example here, I'd like to use Maine General Health. Maine General Health is located in Augusta, Maine, and they often saw their patients driving south to Boston for care. So when Maine General switched from managing long-term payment plans internally to outsourcing, the change also impacted their employees' payment options. So Maine General Health CEO conducted lunch and learn meetings for health system employees to communicate the benefits to those employees firsthand. The CEO was informed and engaged throughout the transition and led by example to the benefit of the revenue cycle team. By ensuring that clinicians were engaged in the transition, as well as the entire employee base, the revenue cycle leaders found that having financial conversations and talking with patients about the financial changes became far easier. Our fourth area for innovative focus is looking at the role of the care and the cost navigator in your organization. Here I'm actually going to tell a personal story. I had a care experience where I was taken down a care path that was both costly and burdensome from a time perspective. Unfortunately, that care path wasn't successful for me So I ended up down a second care path. That second care path was far less expensive and far less burdensome on my personal time. So leaving the experience, looking back at the experience, I really presented some resentment to the organization because I went down a very costly and time-consuming care path, whereas had I been presented with the two different care paths at the onset, I may have made a different decision. I may not have, but I may have. But because I wasn't given that decision at the time of care, it really fostered a sense of resentment. And I've personally made a shift in the healthcare provider that I use as a result. I'm highlighting another story, that of CentraCare Health. When they implemented the strategy of reviewing that care and cost navigator role, they did so by focusing on a particular service line. The CentraCare team was able to insert a staff member physically into the OB/GYN area to be part of the intake process. And in just a matter of weeks, CentraCare increased their point of service collections by 25%. In addition to helping patients put financial care plans in place for themselves and their babies. They started with what they called a financial health dashboard that was specific to the OB/GYN area. And they did that because it helped level set with the clinical team the lost opportunities for revenue, as well as got the group on board for a closer working relationship with revenue cycle during the care process, as opposed to after the care process. Our last area for innovation is closing the loop with the patient, specifically at discharge. Discharge shouldn't be just about delivering the patient a care or a clinical plan and letting the patient know that they'll be billed at some time in the future. To drive innovation, we recommend creating the patient's financial plan in addition to the care plan and providing that to the patient at the time that they discharge. Here we have an example of typical discharge instructions with clinical or care information at the top, but we've layered in financial information at the bottom. We've shown the patient that we have their insurance, we've provided an out-of-pocket estimate, and if the patient selected a payment option as part of their pre-registration or registration experience, we've put that payment option into the financial notes so that they have that along with their care plan as they leave your facility. So by example here, I'd like to talk a little bit about Novant Health. Novant Health focuses on the patient's experience in a way that's, quote, easy for me being the patient. So with that in mind, they gather patient feedback at numerous points in the patient's interaction. And it's important to note that these patient surveys aren't done in a department by department fashion. They take patient comments holistically to look at the entire journey. And by doing that, that's helped Novant Health make adjustments so the patient's interaction is more seamless before, during, and after care. So to summarize our conversation today, improving patient loyalty is as necessary to protect and increase market share as is embracing consumer retail tactics. To drive innovation with the resources you have today, consider which resources you can use, whether it be the marketing group, thinking like your patient, better leveraging your C-suite, looking at the roles of your cost and care navigators, or closing the loop with patients financially at the time of discharge. So, Lori, that takes us through our conversation today. I'd like to take this opportunity to open up the floor to questions from the group if there are any.
Okay, great. Thank you, Pete. And again, just a reminder, if you have any questions, please use the Q&A chat function or Q&A function at the bottom of your screen. Pete, so the first question I have here is, what percentage of healthcare systems do you see that really are focusing on financial planning up front, those financial planning conversations?
Yeah, so that's a great question. In our experience, just about every large healthcare provider is talking about moving some of the financial conversation up front. And really, with the individual providers, the question becomes, how much of that financial conversation do you want to have? Is it limited to talking to the patient about their copay and collecting their copay? Do you want to expand that conversation to talking to the patient about their cost estimate? And then if you want to move beyond that, the solutions that you have for addressing that cost. Certainly, we recommend that you go the whole distance, right? That you start having those financial conversations prior to care through your pre-registration teams and at the point of care through your care navigators or your registration staff. In terms of the direct answer to the question, what percentage, we're seeing probably half to 60% of the providers that we work with are moving towards having that full conversation up front, with the remaining 40 to 50% having some type of financial conversation, but maybe not to the point of offering and capturing the patient's solution.
Okay, great. Thank you. Next question, how does ClearBalance differentiate themselves from other patient financing companies?
Sure, another great question. So the way that we've approached patient financing is to ensure that all patients can participate. So we know that typically the most financially impacted patients, those that are the most challenged to pay, are the ones that need financing or need a payment option the most. So we've focused our solution on ensuring that everybody participates and that everybody participates in the same way. So we're not taking a percentage of individuals that may have a higher propensity to pay and giving them one option, taking those with a lower propensity to pay and giving them a separate option. There's some challenges around discrimination and compliance when you do things like that, as well as, as patients talk, we want to make sure that they all know that they have the same option to pay. So that's one large area of focus, one large area of differentiation. Another large area of differentiation for us is the ability to engage or enable technology to assist the patient. So we want to make sure that the patient is being engaged both from your staff perspective, but also online if they're using, if you're an Epic health system, MyChart, if you're not an Epic health system, whatever your online engagement tools are, we want to make sure that we're providing the patients options through those online engagement tools in a seamless fashion. So if the patient is, for example, in MyChart and they go to the Pay My Bill section, that patient has the opportunity to enroll in a payment plan directly through MyChart without having to step outside of MyChart or call staff. So in terms of differentiation, it's all patients can participate, and technology, the ability to enable technology to engage patients in payment options.
Okay. All right. We have a couple of other questions here that are somewhat related. So I'll ask this one first. With elective procedures down and some level of COVID-19 reimbursement coming from the government, how can healthcare organizations use patient financing to keep their patients engaged and loyal today?
Yeah, that's a great question. So I'll address it from the engagement side and then the financial side as well. On the financial side, we know with cases being down that health systems are going to be pressured financially, primarily from a cash flow standpoint, but certainly from an income statement standpoint as well. Patient financing is well positioned to be able to accelerate cash to an organization because when that patient that needs that payment plan participates in financing, you as an organization are getting paid for that full receivable up front as opposed to having to collect it and recognize that cash over time. So from a financial perspective, that is certainly a benefit of financing. From an engagement perspective, because that patient is continuing to make that payment, well, I'll take a sidestep. Most patients are continuing to make those payments. Certainly we're experiencing patients that are impacted by the crisis and are asking for payment waivers. But beyond just that ability to offer patients things like waivers, which creates engagement, the ability to continue to get to that patient each month, get that statement in front of them, get them making that payment, allows them to engage with ClearBalance and with the healthcare organization beyond just a clinical experience.
Okay, so here's kind of like a related follow-up question. What happens when a patient stops paying?
It's a great question, especially in today's environment. So I will say specifically to ClearBalance, we've been able to put payment waivers in place as it relates to this crisis. So any patient that communicates to us that they don't have an ability to pay, we are allowing them essentially a 2-month waiver. And so from a health system perspective, if you were managing that payment plan, that's 2 extra months without that cash coming in a financing environment. You've received the cash up front. So the fact that we're allowing the patient a 2-month waiver doesn't impact you as a healthcare organization. So I'll kind of go beyond that to just now generally what happens for a patient that stops paying. In our programs, we do the follow-up with patients. We do that telephonically, through the mail, through email, and through text engagement to work with the patient to allow them to talk about what's impacting them, why they're not able to make that payment, and hopefully come up with some solutions for them. There's a number of solutions, including deferred payments or lowering payments for a period of time that we're able to do for patients. Kind of taking that through to conclusion, with specifically the ClearBalance program, we have both recourse and non-recourse solutions. So for patients or for health systems that are participating in a recourse-based solution, patients that don't pay for a period of time, eventually that account goes back to the health system and presumably through the health system's collection process. In a health system that has a non-recourse solution through ClearBalance, we would continue to pursue that patient. If that patient defaulted on their payment plan or their financing, that account would stay with ClearBalance. That account would not go back to the health system. So you have 2 outcomes at the end of the collection process, depending on whether the solution the specific provider has is a recourse or a non-recourse based solution.
Okay, and you touched on both of these topics a little bit, and maybe this question will allow you to bring it together. How do you see self-service technology supporting financial planning setup, and then as well as ongoing patient engagement and patient payment management?
So I would say, especially given the crisis and then just kind of beyond trending, certainly we're seeing the patient being able to self-enroll or get online in advance of their care is something that will only be expanding going forward. I think as healthcare providers, what this crisis has highlighted is how much we're interacting with patients in a face-to-face manner and how that interaction can be moved digitally because, quite frankly, we're being forced to move it digitally today. So I only see that trend accelerating as we move forward. And in terms of the financial engagement, as we look to push more of our clinical connection with patients into the digital space, whether that's telehealth or online. We want to make sure that we're stepping along from a revenue cycle standpoint and staying in lockstep with that clinical digital integration. We want to make sure that the patient's payment estimates, their estimate of care, as well as their payment options are being presented in those digital environments, both prior to care and then through the care continuum that we talked about today.
Okay, great. Okay, that wraps up the questions we have in chat and the Q&A section. So thank you all for contributing the questions. Thank you, Pete, for your presentation today and sharing your expertise. Everyone, as you exit the webinar today, you'll be routed to a survey, and one of those questions will be to include email addresses. Well, actually, this doesn't apply either. Sorry, I'm reading from our canned presentation, but normally you might be gathering in rooms together, and so I wanted everyone's email address in your meeting room. So again, sorry, that doesn't apply. But you can email me, Laurie Heavey, lheavey@clearbalance.org, if you don't receive your CPE form by Friday. And also remember that this presentation is going to be available on the Georgia HFMA website in a few days, and we'll put the recording on our Georgia HFMA YouTube channel. And next week, we'll continue our discussion about COVID-19 with a financial and regulatory presentation. So please be sure to register if you haven't yet. And you can register for the Wednesday webinar series either through the events section on the Georgia HFMA website. And we're also sending regular emails, the weekly Georgia on My Mind, as well as webinar focused emails. So please be on the lookout for those. Thanks again, everyone, for joining us today. Stay safe and have a great afternoon. This concludes our presentation.